The most common cause of postoperative bleeding with periodontal and implant surgery is when we do soft tissue grafting or gum grafting procedures. Typically we harvest or get the gum tissue from the tissue of the palate. We can take a small piece of gum tissue from the palate and then transplant that to another area of the mouth to increase the amount of gum tissue in an area that's insufficient. After those procedures are completed, we send you home. We don't send you home with any active bleeding, but it's not unusual, an hour, 2 hours, several hours after surgery to experience bleeding from the palate where we harvested the gum tissue. Again, no reason to panic, but there's a sequence of things we'd like you to do to stop the bleeding. The first thing we would ask you to do is to take a piece of gauze, which we provided you, hold pressure, moderate pressure on your palate. Once you've identified the source of the bleeding, hold the gauze with your thumb on your palate for 5 minutes. No peeking, no looking. You have to maintain constant pressure for 5 minutes. Then gently remove the gauze, see if the bleeding's been controlled. If they're still easing, I'm going to ask you to repeat that with the gauze, moderate pressure with your thumb for another 5 minutes. You may need to go through that sequence several times to ultimately control the bleeding. If that doesn't work, we've also provided you with a tea bag. If you moisten the tea bag, in other words, take it out of the packaging, moisten the tea bag, hold the tea bag on the area that's bleeding for 5 minutes, that can typically then control any bleeding any residual bleeding.